Yeah, hello friends once again. Well, we need to continue with the role of beta blockers in the management of congestive heart failure. Well, what is the mechanism of action and how do they act? That is important for us to understand. Well, first of all, what exactly the beta blockers do in patients with congestive heart failure is that they reduce or they decrease the heart rate. Secondly, it increases the diastole, that is the period of relaxation is increased. So once the diastole is increased or the period of relaxation is increased, ventricular filling time will also increase. Well, this due to the increase in the diastole and the ventricular filling time, there is a resultant stretch on the cardiomyocytes, and this stretch leads to an improved force of contraction of the myocardium. Hence, it will improve your cardiac output, but you need to be cautious that beta blockers can worsen the cardiac output. Hence, they have to be prescribed with caution in cases of CHF. So, to highlight it once again and for a better learning and remembering, it decreases the heart rate, it increases the diastole, it increases the ventricular filling time, it improves the resultant stretch, or it increases the resultant stretch on the myocardium, which improves the FOC, that is the force of contraction, and which ultimately improves your cardiac output. So the role of beta blockers in congestive heart failure has to be used with a word of caution. So we go on to the next slide. What are the contraindications? Well, as you are aware of, in the previous slide we spoke that it reduces or it decreases the heart rate. Well, what will be the contraindication to the use of beta blockers? Well, they should not be administered to patients with heart failure who have bradycardia, that is, whose heart rate is less than 60 beats per minute, or the patient is having heart block, or has a hemodynamically unstable condition. So all these conditions are contraindications to beta blockers administration. So now we go on to the next slide and we will talk about the next disease which is there. Well, heart blocks. Well, they are known as atrioventricular blocks as arise from the atrioventricular nodes. So they cause bradycardia, and there can be first degree blocks, there can be second degree heart blocks, and there can be third degree heart blocks. Well, the first degree heart blocks, they manifest as PR prolongation. That means in the ECG you will have P to R distance prolonged between the subsequent complexes. Then second degree heart block means there is a type 1 second degree heart block. It's also known as the Mobitz 1 or Wenckebach's. Then you have type 2 second degree heart block, also known as Mobitz 2. Then you have third degree heart block, which is also called as a complete heart block. Well, these are the conditions where beta blockers are contraindicated because they are already in a state of bradycardia, that means reduced heart rate. Well, there is a next disease which we are going to talk about is portal hypertension. Portal refers to hepatic. Basically, it is related to the system of nerves which are related to your hepatic system. So whenever there is an elevation of hepatic venous pressure gradient to 5 millimeters of mercury or more, then that is called as portal hypertension. Well, generally you don't measure the portal pressures, and for that you use tips. This is a way of TIPS. It is a method with which you measure the pressures in your portal veins. Well, portal hypertension occurs when there is an obstruction to the blood flow through the liver and the pressure rises within the portal vein. Well, this obstruction can be intrahepatic, which means inside the liver. It can be prehepatic, which means before the liver, or it can be posthepatic, that is post means after the liver, that means after the veins. Portal vein, so it can be before the entry of portal vein into the liver, it can be after, or it can be within the within the liver itself. What are the complications of portal hypertension? Well, it can lead to, of course, failure, that is liver failure. It can lead to GI bleeds from swollen veins, which are called as varices. GI bleeding from varices, that means swollen veins. Ascites, it can lead to ascites, that is accumulation of fluid in your abdominal cavity. Hepatic encephalopathy, that means again your functions of the brain are impaired. You can have splenomegaly, that means increase in the size of the spleen. There can be anemia, that means there will be a mismatch, or there will be a between the demand and supply of oxygen. Then there might be leukopenia, which means low WBC counts, and of course thrombocytopenia, which means low platelet counts. All these are manifestations or complications of portal hypertension. Well, what is the role of beta blockers then here? Well, beta blockers, they lower the cardiac output, that means via the blockade of beta 1 receptors, and cause splanchnic vasoconstriction, which means they cause constriction of the vessels which supply your abdomen, and this will reduce the portal and the collateral blood flow. So once the portal blood flow and the collateral blood flow is reduced, then it causes a reduction in your pressures. So this is an important medication for treating portal hypertension. Well, now we go on to the next disease, which is called as hyperthyroidism. Well, hyperthyroidism is a disorder that occurs when the thyroid gland makes more thyroid hormone than what the body needs. It is also called as thyrotoxicosis for too much of thyroid hormone in the blood. Well, thyroid hormones circulate throughout the body in the bloodstream and act on virtually every tissue and cell in the body. Hyperthyroidism causes many of the body's functions to speed up. These include palpitations, tachycardia, tremorlessness, that means a person is having tremors at rest, anxiety, and heat intolerance, which means the normal temperatures can be outside, can be 22 degrees centigrade, and the patient is complaining of sweating and excessive heat around. So that is, he is intolerant to heat or to rising temperatures. Then what are the three main hormones which are responsible for hyperthyroidism, or which help the doctor diagnose hyperthyroidism? Well, the thyroid gland makes two thyroid hormones. They are triiodothyronine, that is T3, and thyroxine, that is tetraiodothyronine. Well, T3 is made from T4 and is also more active hormone, directly affecting the tissues. So thyroid hormone production as such is regulated by the TSH, which is produced in the pituitary gland in the brain. So TSH produces, or it sends signals to form T4 and T3, and from T4 the thyroid gland makes two hormones, I have said, T3 and T4, and T3 is made from T4, so it is T4 dissociates or breaks to form T3. When thyroid hormone levels in the blood are low, the pituitary releases more TSH. So if in your blood T3 and T4 are less, then TSH from the pituitary releases or stimulates the thyroid gland to produce more hormones. When thyroid hormone levels are high, the pituitary responds by decreasing TSH production. So beta blockers, well, the use of beta blockers in hyperthyroidism is that they ameliorate the symptoms of hyperthyroidism that are caused by increased beta adrenergic tone, which means that they reduce your heart rate, the tremors, and so beta blockers ameliorate means to reduce the symptoms of hyperthyroidism, which I have discussed in the previous slide. So they are the first line of drugs in the treatment of hyperthyroidism, which can be followed by your normal thyroid drugs. So once again, to do a recap, what are the symptoms of hyperthyroidism? Well, hyperthyroidism has many symptoms that can vary from person to person. Some common symptoms of hyperthyroidism are nervousness or irritability, fatigue or muscle weakness, heat intolerance, trouble in sleeping, hand tremors, rapid and irregular heartbeat, frequent bowel movements or diarrhea, weight loss, mood swings. Well, there is a condition called as goiter in which your thyroid gland is enlarged, and that may cause the neck to look swollen and can interfere with the normal breathing and swallowing. So we just need to know what is goiter. So we know the symptoms, we know why beta blockers are used in hyperthyroidism. So it is a new indication, so where we can go and promote Metpure XL. Then hyperthyroidism, again, how it is diagnosed. Well, we have the symptoms of hyperthyroidism as we have discussed, and secondly, there are some tests. Well, there is a TSH test. TSH is the most accurate measure of thyroid activity available. The TSH, that is thyroid stimulating hormone test, is especially useful in detecting mild hyperthyroidism. A TSH reading below normal means a person has hyperthyroidism, and a reading above normal means a person is having hypothyroidism. T3 and T4 test. This test shows us the levels of T3 and T4 in the blood. With hyperthyroidism, the levels of one or both of these hormones in the blood are higher than normal. So when in case of hyperthyroidism, when the levels are high, a TSH reading is, you can see here, below normal. So T3, T4 on the higher side, then TSH will be below normal or it can be normal. And in case of hypothyroidism, you want that the pituitary should work more, so the readings are above the normal and your T3, T4 levels in the blood will be lower than the normal. So it is just the opposite. When we use the term hyperthyroidism, then your T3 and T4 levels, this test shows that the levels of T3, T4 in blood. So with hyperthyroidism, the levels of one or both of the hormones in the blood are higher than normal. So T3, T4 levels are high in hyperthyroidism and TSH is low. Opposite is the case with hypothyroidism. I am re-emphasizing, I am trying to try to explain you why this is happening. Well, it is the blood. In the blood you have T3 and T4 hormones, and TSH is the hormone which is produced from the pituitary. So if you're in case of hyperthyroidism, T3, T4 values are higher, so a signal is sent to your brain that we don't need any more, so TSH activity is reduced, so the TSH is less. Whereas in hypothyroidism, these hormones are less in the blood, that is T3, T4 values are less in the blood, so it sends signal back to the brain, we want more thyroid hormones, so the TSH value increases. So in hyperthyroidism and in hypothyroidism, it is actually paradoxical. So we need to just remember this, understand it, and reproduce it whenever needed for the tests, of course. So how is hyperthyroidism treated? Well, the main aim of treatment is to bring thyroid hormone levels to a normal state, thus preventing long-term complications, and to relieve those uncomfortable symptoms like tachycardia, intolerance to heat. Then we spoke about tremors and inability to speak, anxiety. All these have to be controlled. So medications which reduce the symptoms of tremor, rapid heartbeat, nervousness, anxiety are the beta blockers, but do not stop thyroid hormone. But the only thing is that they don't affect the thyroid hormone production. So we need simultaneously anti-thyroid medications also. So beta blockers along with anti-thyroid medications are used to treat hyperthyroidism. So with this, I will probably end here today. We can talk about the different slides later about COPD, and we can discuss about it at a later time. What I want you is to understand the thyroid disease, the diagnostic test, so that we are thorough with it. So I wish you a happy learning. All the best.